Hello, dear friends. My name is Sofya Dorinskaya. I am a doctor and the head of the Center for Medical Information. Today, we continue the topic of vitamins for the eyes. I want to warn you right away that it is very, very hot here, and I have a fan blowing on me so I can stay in the room. So if there is any noise, please excuse me. So here is our topic. Vitamins for the eyes. Here is our diagram of the eye, which we showed in the previous video. And today's video will be dedicated to vitamins for the eyes, specifically vitamin C. Today we will talk about how vitamin C affects eye health. So, vitamin C was discovered in 1928. Yes, it hasn't even been 100 years since vitamin C was discovered in Hungary. A Hungarian named Szent György discovered it. He was a biochemist. He isolated vitamin C from bull adrenal glands, from orange peels, and from cabbage. Let's recall a bit about the physiology of vitamin C. In the human body, hypervitaminosis C does not exist. It is impossible to get an excess of vitamin C for the human body. Vitamin C is not produced in the human body. It is produced in the bodies of all animals except guinea pigs, monkeys, and humans. When you take a dose of vitamin C, almost all of it is used by the body. The excess is excreted unchanged in the urine, and some of the vitamin C is relatively stored. High reserves are found in the adrenal glands and in the intestinal wall. These reserves are negligible compared to other vitamins, very small. Therefore, every person must ensure a daily supply of vitamin C for themselves. That is, a person needs to take care of this. Vitamin C is not distributed evenly throughout the body's tissues. How can you develop a vitamin C deficiency? It is also called hypoanavitaminosis. Anavitaminosis is known as scurvy. How can you get it? There are basically three mechanisms by which scurvy develops. How can you develop this deficiency? The first mechanism is a deficiency or absence of vitamin C in the diet. The second mechanism is impaired absorption of vitamin C, for example, in diseases of the gastrointestinal tract and the digestive system as a whole. And the third mechanism is increased consumption of vitamin C. But here it correlates with a deficiency of vitamin C in the diet, because it turns out that a person doesn't get enough of the vitamin even if they eat it in their food. So this is considered increased consumption. What is it? This includes, for example, pregnancy, all types of inflammatory diseases of absolutely any kind, psycho-emotional overload, any kind of exhaustion, and stressful situations, because vitamin C is used up when the adrenal glands are working and adrenaline is released. In general, that is, any increased consumption of vitamin C occurs in any situation, for example, with ocular tuberculosis. The amount of vitamin C in the eye, in its tissues, is reduced compared to the normal state of a person. Moreover, the amount of vitamin C in the eye is inversely proportional to the severity of inflammation, meaning the less vitamin C a person has. Naturally, as a result, in the eye, it is also deposited in certain parts, for example, in the anterior chamber of the eye. Here it is, marked in orange on my diagram, the anterior chamber of the eye. And it is also present in the lens. Here it is marked in blue. On my diagram, this is the lens, and vitamin C is present there. So, the lower a person's saturation with vitamin C, the more intense the inflammation. In other words, it's an inverse relationship. Vitamin C attracted the attention of ophthalmologists when the close relationship between vitamin C and the lens was discovered. Here we have the lens, here it is in blue, and the lens itself. So, in the blood of a cataract patient, the amount of vitamin C is sharply reduced. When they tried to saturate cataract patients with vitamin C, there is such a thing as a vitamin C saturation test. This is when a person is given high doses of vitamin C. They observe how long it takes before vitamin C starts to be excreted in the urine. So the saturation time with vitamin C in cataract patients was significantly longer than in people who did not have this disease. Further, it was discovered that in cataract patients, the amount of vitamin C is sharply reduced, specifically in the anterior chamber of the eye. It is reduced there. In cataract patients, it is drastically reduced. Vitamin C has a selective affinity for the fluid in the anterior chamber of the eye. In other words, they are almost like relatives. The scientist Sella found that in the anterior chamber of the eye, right here in this orange area that I have shaded, the more vitamin C there is, the greater the overall saturation of vitamin C in the human body. That is, the more saturated the human body is with vitamin C. Ballou showed that there is a factor in the lens that preserves vitamin C. In other words, vitamin C does not oxidize. It is not destroyed in any way, rather the lens preserves it. The authors extensively debate the question of whether, in general, vitamin C can be considered a remedy for cataracts. The argument against this is that when attempts were made to treat cataracts with vitamin C, no changes occurred. That is, the lens did not become transparent again. However, the established scientific fact that vitamin C saturation directly affects the transparency of the lens is something that is absolutely not doubted or questioned by the authors. Virtually every single researcher and author who has ever studied the human eye, because it is highly probable and most likely that vitamin C is involved in restorative processes and in the respiratory processes of the eye. This is its main function. Where do we say that the positive effect of vitamin C is indisputable? When we talk about eye surgeries, vitamin C definitely prevents hemorrhages into the vitreous body and, in general, hemorrhages in the eye. Also, almost all authors, all surgeons now, carry out vitamin C therapy. That is, they saturate the patient's body with vitamin C before surgery. Why? Because it has been observed that the healing of the eye in a person who was saturated with vitamin C before surgery is much faster. And the better the person was saturated with vitamin C and had no signs of hypo or avitaminosis, the better the healing. And naturally, the worse it is, the poorer the body is in vitamin C. So vitamin C protects against hemorrhages. I want to remind you that in one of my talks dedicated to vitamin C, we discussed that a deficiency of vitamin C leads to hemorrhage or bleeding. Well, in fact, when it comes to the human eye, we see exactly the same results. The healing of the cornea after corneal surgery largely depends on how well the person's body is saturated with vitamin C before the operation. Therefore, if a surgeon or doctor schedules a person for surgery, they must ensure that the patient receives sufficient doses of vitamin C both before and after the operation. This will protect the person from hemorrhaging in the eye and will also promote better healing. Let's briefly review what we've discussed. And also vitamin C. It plays an important role in the respiration of the lens, accumulates in the anterior chamber of the eye, is retained in the lens, and also affects the transparency of the lens. That was the information regarding vitamin C and the eyes. I would just like to take a quick moment to remind you, my dear friends, that subscribing to our channel and sharing these videos on your various social media platforms helps a great many people. We constantly receive a lot of wonderful messages from viewers saying, "Thank you so much for this. I happened to see your video just in time." Your support really helps our community. Or expressing regret like, "Why didn't I see your video earlier?" So if you want to help your friends and loved ones feel good and receive the information they need in a timely manner, it's very important that you subscribe to the channel and share this video on social media. Also, when we reach 500,000 subscribers, we will be giving away several sets of books by Professor Lepsky. And subscribing doesn't cost you anything. This is for people who have been subscribed to the channel for a long time and who want to take part in this game. Maybe you'll win this set yourself. It will be nice. It will be great. Maybe you will win this set too. Worldwide shipping is free for the winners. I also want to mention that we have groups on social networks, Facebook, Odnoklasniki and VKontakte. The groups are called Evidence-Based Medicine. You can find them by searching, so go ahead and subscribe. As for the content, well, I create it myself, so it's not dumb content. I regularly post quotes from books by professors like Lepsky. These are the kind of quotes, that you can actually use. I try to pick ones that provide answers to certain questions. I select these quotes from those books. I also interact with you there and post some news on social media. And I share my own thoughts, useful articles that I find and believe aren't available anywhere else, and that deserve the attention of our subscribers and people interested in this topic, with my own commentary. So please join the groups and subscribe. This isn't empty, purely entertaining content. These are intelligent groups and they won't overwhelm you with unnecessary information. Thank you for your attention. If you have personal questions, you can write them in. We now offer a written consultation service where for a small fee you can receive a competent, thorough written consultation regarding your question. And within this consultation, a person can ask a question and receive a written answer to it. Also, of course, our method for identifying nutrient deficiencies, hypoanavitaminosis, and helping to address them and restore health. We are working, everything is going well for us. Everything is stable here, we are waiting for you, and thank you for your attention. This was Sofya Dorinskaya with you.